Hello students, I am Dr. Bindu, Professor from the Department of Prosthodontics, Crown and Bridge from Vinayaka Mission's Shankaracharya Dental College, and today I will be covering on the topic connectors and fixed partial dentures. The learning outcomes for today's topic is that at the end of this lecture you are expected to know, or you should be able to define what is a connector, classify the types of connectors, and discuss the criteria of selection of a connector and its applications. Before we dive into the topic, I would like to introduce you to what a fixed partial denture is. If you look at this picture here, this is going to be a retainer, and this is the pontic that replaces the missing tooth, and here is your connector, which means the connector is going to be part of your FPD, which is going to connect or join your retainer and pontic. Coming to the definition of connectors, according to Rosenstiel, connectors are the components of a partial fixed dental prosthesis or splint that join the individual retainers and pontics together. According to the glossary of prosthodontics terms, the portion of an FPD that unites the retainer and a pontic. When it comes to connectors, it is classified into two types, namely the rigid connectors and the non-rigid connectors. The rigid connectors are basically connectors that have no movement between individual components, whereas in non-rigid connectors there is limited mobility between the components, that is the retainer and the pontic. This is the classification of connector. You have rigid connectors and you have non-rigid connectors. Under rigid connectors you have cast connectors, soldered connectors and loop connectors. Under non-rigid connectors you have tenon mortise connector, split pontic connector and a cross pin and wing connector. Coming to the ideal requirements of a connector, the connector should be wide enough to provide strength to the unit but not wide enough to hamper the oral hygiene maintenance, and it should occupy the normal interproximal areas but should preserve the embrasure space. The connector should be placed lingually and incisally for better aesthetics, and there should always be a width of 0.25 millimeter between each retainer. Coming to rigid connectors, these connectors do not allow any movement and are indicated when the entire masticatory load is to be transferred onto the abutments. They can be directly cast as part of a multi-unit fixed partial denture, or different units can be joined together by means of soldering. Coming to the connector design, the ideal requirement of a connector design is the shape, size and position of connectors, which all influence the success of a prosthesis. Coming to design principles of connectors, first we will discuss in detail the size of the connector. The size of the connector must be sufficiently large to prevent distortion or fracture during function, but should not be too large, otherwise they will interfere with effective plaque control and contribute to periodontal breakdown over time. The recommended occlusogingival height of the connector is ideally 3 to 4 mm. If you look at this area, this is the recommended height occlusogingivally for the connector. Coming to shape of the connector should have a concave shape mesiodistally, and it should appear like a meniscus, something that is going to be like your test tube, the bottom of a test tube, where it will have a gradual transition, and it should be convex buccolingually. For anterior teeth, the connector should be placed lingual, and use of a large connector or inappropriately shaped connector results in display of metal, leading to aesthetic failure of the fixed partial denture. Coming to cast connectors, the cast connectors are a metal union between the retainer and a pontic in FPD. These connectors do not allow any movement and are indicated when the entire masticatory load is to be transferred onto the abutments. Coming to soldered connectors, this involves use of an intermediate metal alloy whose melting temperature is lower than that of the parent material. This allows accurate soldering with minimum distortions. Soldered connectors are usually used in case of long span bridges, wherein there you might expect some amount of distortion between the units. So what happens is, during the wax pattern stage itself, if you can notice this picture A, we create a gap with the help of a ribbon saw, and then casting is done, and when this sectioning is done, we make sure that the surface is flat proximally, and this gap should be around 0.25 millimeter, so that there is enough space for the solder material to be placed. Once casting is done, the solder material is placed between the retainer and the pontic and then is soldered. Coming to loop connectors, This is used when an existing diastema is to be maintained in a planned FPD. This consists of a loop on the lingual aspect of the prosthesis. If you can look at this picture, this is the loop on the lingual aspect of the prosthesis that connects adjacent retainers and pontics. In case of midline diastema, giving a regular FPD will increase the buccolingual width, which will not be pleasing aesthetically. That is when a loop connector comes into play. Coming to non-rigid connectors, these are connectors that allow limited movement between the retainer and the pontic and have little amount of flexibility between components. This is indicated when preparing two abutments will not give a parallel path of insertion, or a parallel path of insertion cannot be achieved during preparations. And it is also indicated in case of a pyre abutment, and it is indicated in periodontically unfavorable abutments to reduce the amount of stress to the teeth. Here, the non-rigid connectors are also called as stress breakers. This is the pyre abutment. If you look at this picture, it is a natural tooth located between two terminal abutments and has edentulous space on both these sides, and this is also called as an intermediate abutment. In this situation, if a 5-unit rigid FPD is planned by using all the natural teeth adjacent to the edentulous areas as abutments, forces are transmitted to the terminal retainers, and as a result, the pyre abutment will act as a fulcrum, causing failure of the retainer. Hence, physiological tooth movements, arch position of the abutments, and a disparity in retentive capacity of the retainer can make a rigid connector in a 5-unit prosthesis less ideal treatment of choice in case of pyre abutments. The use of non-rigid connector has been advocated to overcome this problem. Coming to the types of non-rigid connectors, we have the tenon mortis connector or the dovetail connector. We have a split pontic connector, and there is a cross pin and wing connector. Going in detail about the tenon mortis connector, the tenon or the male component is attached to the pontic, and the mortis or the female component is attached to the retainer. Their alignment must be parallel to the path of placement. They can be made freehand or milled, or prefabricated plastic patterns can also be used. If you look at this picture here, this is the male component or the tenon, which will be attached to the pontic, and the mortis or the female component which will be attached to the retainer. If you can look at this picture, you can see that the tenon or the male component is attached to the pontic, and the mortis or the female component is attached to the retainer. Coming to the split pontic connector, this is used in case of a pyre abutment where a minimal amount of movement is required to maintain abutment health. In the split pontic connector, unlike the tenon mortis, we have both the male component and the female component in the pontic itself. The pontic is split into mesial and distal halves which are attached to their respective retainers. A shoe or key is incorporated into the mesial half, and the keyway is incorporated in the distal half. This assembly engages when the FPD is seated in position. If you look at this picture here, you have this component, the mesial shoe, which is attached to the mesial component, and then you have this picture where you have female component attached to the distal most retainer or the distal segment. Coming to the cross pin and wing connectors, these are similar to the split pontic connectors and are used for tilted abutments. The wing is attached to the distal retainer. In this picture, you can see that this is the distal most abutment, and it is attached to the distal retainer, and this is first cemented followed by the pontic, which is cemented later. And once this is cemented, we have this pin which is driven through this hole over here and then secured. Thank you.